stress is something that we all experience. If you're alive and you're well, you will certainly have experienced stress. And though I am not a mind reader and I don't possess that power to look into your future, I can assuredly tell you that you will once again experience stress. Maybe you're stressed now. You see, experience stress, it's not something that we should necessarily fear. I often begin one of my workshops entitled Managing Stress to Optimize Your Well-being and Your Mental Health by correcting the false belief, and I would say demystifying the wrongful assumption that one's ultimate goal should be to eliminate stress. You see, stress is important to ensure our survival from an evolutionary basis. Many researchers investigating the impact of stress on the brain will affirm this finding. In fact, a manageable amount of stress will uphold your cognitive functions, like right now. Let's hope it remains manageable so that I can pay attention, have good memory, good processing speed, but also it will help your executive functions, which means your reasoning, complex information processing, planning, and problem solving. And this to assure that your brain supports you to remain more engaged, energized, and focused on a difficult task like I'm doing right now. Right? And for you to listen. So think about it. If you had to fend off an actual threat, you want your body to actually respond adaptively, right, to that stress. You want to be able to be prepared to fight or to flee that situation. So therefore, this is why being able to react to stress is good. Whether it be to give you also that edge if you're playing a competitive sport, or the ability to speak at a public event. I often tell my patients that no stress means, well, no interest, no motivation, and no care. And ultimately, that can impede on your performance. And we see this in this infamous Yerkes-Dodson curve or law. But the same is also true from unmanageable levels of stress, and you see that on the opposite side of the curve. And we often refer to that as distress. So distress refers to poor management of stress, and it is over time that we should be concerned about, because that's the stress that will essentially impede on our general ability to function. So repeated and heightened levels of poorly managed stress is what we define chronic stress. And it is that chronic stress that over time will change your brain functions and abilities. And earlier when I was referring to the cognitive and executive impairments, that is what we mean here. So when I teach on a neural basis of anxiety, I often refer to chronic stress or consistent exposure to chronic stress as having or putting the pedal to the metal. Eventually, you will run out of gas. And so our brain is built, our brain and body, I should say, there's a complex system that oversees all of our response to stress. And neuroscientists refer to this as the HPA axis. It's a system that's comprised of your central nervous as well as your endocrine system, your hormonal system. So we call it the HP axis because it's comprised of three very critical brain structure and glands that play an important role in managing all the affective emotional information. Like mine would be highly activated right now. So the H refers to hypothalamus, and you see that at the top, the P, pituitary gland, and A, adrenal gland. Now, the hypothalamus is a walnut-sized structure that is deeply rooted into your brain, and it really acts as your body's smart control coordinating center. One of its jobs is to turn off the activation that is releasing the cortisol. At some point, that release of cortisol has to stop, and that's its job. The pituitary gland, the pea-sized gland located at the base of your brain, the job is to send out that signal to activate, amongst other things, the release of cortisol into your bloodstream. So anxiety can result, so we're talking about stress, but anxiety in relation to stress results when we are actually exposed to a situation that is highly stressful, such as maybe an accident or maybe we're the victim of an attack. But it can also occur in the instance of a perceived threat. such as, for example, speaking in public or taking public transportations, and most phobias would fall into what we perceive as a perceived threat. So in other words, anxiety or heightened or chronic stress can arise from an actual stressor, but also one that is perceived. And the thing is that from a perhaps clinical treatment perspective, we treat them very differently, different treatment plans. But your brain actually reacts in a very undifferentiated manner. It doesn't know that it's perceived or not. This is why it feels so real. So we talk about anxiety once your social functioning is actually impacted. So until then, we're talking about a requirement for stress management. But if your stress is so intense that you can no longer function, then that's when we start talking about anxiety, when you're avoiding situations, places, people, events. So if that is the case, where it's impeding on the quality of your life and your relationship, that's when we typically will infer that you might be suffering from an anxiety disorder. Now, women are more likely than men to be experiencing anxiety, actually twice as much, and anxiety affects about 50 to 20% of individuals. So, when your brain detects that you're faced with a stressful situation, this HPA axis instantly becomes activated, and then it unclenches, as you can see, a series of events in your brain, in your body, as the cortisol is going through your bloodstream. But then that's also going to cause a bunch of physiological reactions. Dry mouth, trembling, all the symptoms that I'm sure you've experienced if you've been exposed to an event that was stressful. And so it is this surge of hormones, one of which cortisol that we see here, that will prime your body. It's actually the right thing. It primes your body for fight or flight. In the case of an actual threat, that's good. It's going to make you run faster. It's going to make you fight better, right? But in the case of chronic stress, especially in the case where it's perceived, this is where, over time, it can actually lead to brain impairments. Now, this cortisol secretion will basically also affect, or involves, I should say, another brain structure, the amygdala. That's not pictured here. It's in the form of an almond, but essentially the amygdala is responsible for everything emotional in your brain. It's one of them, but one of the main ones. So the amygdala becomes activated, and that's the one that actually enclenches this series of signals in your brain and body. Now, under normal circumstances, you were at a red light, you almost got into an accident. Now your body, your hypothalamus, wants to deactivate your amygdala. That's fine, right? Because it's periodic. It doesn't happen all the time. But in the case of chronic stress, your hypothalamus is going to be activated a lot, repeatedly, sustainably, right? It's going to sustain this activation. And so what happens is that over time, your hypothalamus becomes overworked. And so it is this overworking of your hypothalamus that will actually be more problematic and possibly be associated, or actually associated, with some of the brain dysfunctions that I was telling earlier. So it has two implications. It has implications on making sure that we address stress if we are chronically stressed, but it also has implications that if once in a while we experience stress, we should not stress too much about it. It's not necessarily going to lead to any cognitive disruption. So why that is that our brain functions that way is very beautiful is that the minute there's an activation, you must have guessed it, this HPA axis works almost like an on and off switch. So one gets activated, and the hypothalamus's job is to turn it off, right? So it's really beautiful because it's your body's natural inclination to attempt homeostasis, which also actually means returning to a resting state. And your body knows how to do this completely naturally. And so what I'm trying to get to here is that we have to better understand how this system works, this HPA axis works, to, yes, better understand why it's important to manage stress, but also not panic at every little thing that we experience, because that's also part of better managing stress, is not catastrophizing or overly exaggerating situations. So essentially, this sort of overactivation will eventually lead, as I was saying earlier, to brain atrophy, which basically means changing the shape of your brain, also cell loss in tandem. And so this will also affect, it's not just this area here, or what I've talked about, the amygdala and all that, but it has implications also for preventing that other brain regions, such as the prefrontal cortex, which is responsible for your decision-making, your social interaction, to also be affected. So, also, you must have noticed that when we are more stressed, we tend to be more susceptible to viral infections, and that's because the surge in cortisol also impacts our immune system. But now the good news, okay, because I'm done with the good news. What do I do, Tina? I realize I am stressed. Well, the good news is that you are not defined by your anxiety, and anxiety can be overcome. I know that for a fact. This is the part of my work that is most exciting and I enjoy the most, is really accompanying. I have the privilege of accompanying people through their journey of learning to become better at managing stress, and I get to be a witness of that. So, going back to my title, Making Baby Steps, and I'll try to accelerate a bit, but it's a process. When you're a manager, you manage all the time if you're doing a good job, right? You manage situations, and so the process of change, it requires that you consistently work at it. So one of the first tools I'm going to present to you today is essentially the one that you do possess the ability to change the way you think. And so if I were, and I know this is, maybe some of us are a bit reactive at the first season snowfall when we have some sunlight today, but what I'm trying to illustrate here is that you may not feel as though you're capable of changing the way you think, but you are. And the thing is that why it's so important is that most situations that are causing anxiety are perceived. And it is possible to change how you think, because if I were to ask parents in the room, and if there were children here, how they react to this image, the more neutral image here, they would not necessarily have the same response to when they view the image. The point I'm trying to get to is that it's not the image itself that makes you anxious. If it did, it's what that is associated with, right? Is it an opportunity, as in kids playing in the snow, or are you thinking about the negative aspects of being exposed to the first snowfall? And so why we do this, it's very complex, but essentially we're sort of conditioned. We learn these behaviors, these fears over time, and it affects the way we think and view the world. So the good news is that that can be changed. If we notice that we're leaning towards the anxious thought, we can shift our mindset and go more towards viewing it as an opportunity, like today. So here, the second one I will say is avoiding challenging situations. A lot of the times, things that are hard, just accepting this public speaking engagement today was a challenge for me, but I accepted it because it's an attempt for me to avoiding situations that I fear. And it basically exposes me to an opportunity to learn new skills, learn something about myself, and learn something about others as well. So the idea with the avoiding and why it's maladaptive, I will say, most of us will be inclined to removing ourselves from a situation that we fear. And I don't want to make you feel bad about that. It's very normal. Most people do. It's very sort of visceral. We don't want to be exposing ourselves to that chain of events that I described earlier, right? We want to avoid that. So it's very normal. But why we say it's maladaptive is that if I avoided coming today, next time I'm asked, I'm right back where I left off. I didn't learn anything. I'm right back stressed where I was, and I would have missed this opportunity to learn that I can actually overcome challenges. And this is very critical for your brain, but also for your esteem. So therefore, it's really important that we just learn to try to face and take that risk. Now, because we're not always going to do well at changing and shifting our perspective, we're bound to fail. Because we're bound to avoid at some point, we need something to help us out. And this is where self-compassion comes into play. It really helps you need large doses of it. I had to rely on large doses of it yesterday after my dress rehearsal. Because the reality is that the way that I had perceived that this would go today is not how it ended up happening, and it didn't meet my typical delivery or the way I usually perform. And that really upset me. And that's the thing with self-compassion, why it's so critical, is that, there are things that we don't always can plan for. We can't account for. We can't account for how we're going to feel in a certain area. We can't account for who's going to be there and how things are going to play out. And so this is why self-compassion is that emotional balm to help us be able to overcome, give ourselves that space to make mistakes, but also forgive ourselves, just like we would provide emotional support to a person that is experiencing a loss or is sad. We do that to others. We forget to do it for ourselves. So that's what self-compassion is. It's not about making excuses for ourselves. It's not about telling ourselves that we're better than others. It's just about giving ourselves another chance to try again and maybe learn something different. And so I will end with this, but if you really sort of use these things and really commit to change, because it's really a process. And just remember, I feel like managing stress, in preparing this talk, it came to me like manage. You're a manager. You're not a manager on Monday and then you're no longer a manager and I manage one project and I give up. We manage all the time. So in managing our stress is the same thing. It is continuous. It will be a process. But I can assure you, I can assure that once you do that, you will change. And I've already probably gone over my time, and I will quickly wrap up. But the reason why this is so critical, what you do to yourself, how you learn to manage your own anxiety, and I should say stress and anxiety, is so critical because it doesn't just have implications onto yourself. It has intergenerational implications. So some of the research that I'm conducting now with the Montreuil Antenatal Wellbeing Study, or MOS for short, really aims to investigate the benefits, I should say, of early intervention when it comes to anxiety, but we also investigate the impact of stress, of maternal stress, on the child's developing brain. But we just recently got a grant, and we're able to basically now test for mothers that take part in early interventions, that they learn to manage their stress and anxiety. We're looking at now being able to measure the long-term effect, benefits that it will have on the unborn child. So this is in a nutshell what we do in terms of research. I will end on this in summary and in closing in telling you to remember. Remember that your anxiety does not define you, or I should say anxiety does not define you. It may feel like it's overwhelming. It may feel like it's part of you, but it's just an emotional experience. And so you need to repeat to yourself that it's just an emotional experience like anything else, like any other emotions that we feel. And also reframe it. Reframe whenever you feel anxious. Remind yourself it's evidence. It's evidence that you're alive, that your HPA system is working well, and essentially just really sort of allow yourself in that space, the place and the space to learn from it. And so in closing, I will tell you, best of luck in hopefully your own journey of managing stress. And hopefully there's something that you take away from this talk that will be useful to you. So thank you very much.